What is the reason for snoring? During sleep, the whole body relaxes, including the mouth, tongue, and airways, such as the nose and throat, which make them vibrate when we breathe, causing snoring. It is estimated that about 40% of adult men and 24% of adult women are regular snorers. Is snoring dangerous? Although snoring is harmless, it can also be due to a serious health issue when it is associated with obstructive sleep apnea and chronic diseases, such as type 2 diabetes and high cholesterol. What causes snoring? Snoring can be due to lifestyles such as smoking, consumption of alcohol and sedatives, or sleep positions, but it can also be associated with genetics, such as inherited genes that shape the head and neck anatomy of an individual. 1. Snoring and obstructive sleep apnea, OSA. Obstructive sleep apnea is a condition characterized by intermittent episodes of partial or complete obstruction of the airways due to soft tissue falling at the back of the throat when sleeping. It is estimated that approximately 34% of middle-aged men and 17% of middle-aged women are diagnosed with OSA. To learn more about sleep apnea, check out our corresponding video. 2. Snoring in head and neck anatomy. The shape of the head and face, the anatomy of the upper airway, and the circumference of the neck are predictors of sleep apnea and snoring in individuals. A large tongue, craniofacial abnormalities, a receding chin, and a small jaw are associated with the reduction of the size of the upper airway, which increases the risk of sleep apnea and snoring. A neck circumference that is higher than 16.5 inches is also a risk factor for sleep apnea and snoring. Abnormalities in cells that control breathing, known as chemoreceptors, can also reduce the size of the upper airway. These anatomical characteristics may be due to inherited genes responsible for increased risk of sleep apnea and snoring. 3. Snoring and alcohol. Alcohol consumption increases the relaxation of soft tissues in the upper airway, causing sleep apnea and snoring. A study showed that alcohol consumption increases the severity of snoring, sleep apnea, and decreases the levels of oxygen in blood and tissues. 4. Snoring and sedatives. Analgesics, anesthetics, opioids, and sedatives can also increase the relaxation of the tongue and soft tissues in the upper airway, resulting in sleep apnea and snoring. 5. Snoring and smoking. Cigarette smoke can irritate and inflame the nasal cavity and the upper airway, making them swell, which reduces the capacity of breathing. Another cause may be associated with nicotine withdrawal during sleep, that causes sleep instability that increases the risk of sleep apnea and snoring. 6. Snoring and sleep position. Sleeping in the lateral side is the best position, while sleeping on the back is likely to increase sleep apnea and snoring. This difference is due to gravity that increases the tendency for the tongue and soft tissues to fall to the back of the throat, causing obstruction of the upper airway. 7. Snoring and chronic nasal congestion. Chronic nasal congestion is characterized by inflammation and swelling of the nasal cavity and the sinuses that lasts for more than 3 months, resulting in reduced breathing through the nose. Chronic nasal congestion can be caused by sinusitis, nasal polyps, allergic rhinitis, or a deviated nasal septum, which is the wall between the nasal cavities. A study found that nasal congestion during sleep is a strong risk factor for habitual snoring. 8. Snoring and aging. The relaxation of the muscles of the upper airway is a normal event in aging, which explains why it is common in the adult population. However, persistent snoring is an indicator of a potential reduction of oxygen levels in blood and tissue associated with sleep apnea. Persistent hypoxia may increase the process of aging, promoting hallmarks of aging such as stem cell exhaustion, telomere attrition, and epigenetic changes. 9. Snoring and being overweight. Being overweight or out of shape can reduce muscle tone and increase fat deposition around the neck and throat, which can promote the obstruction of the upper airway, causing sleep apnea and snoring. 10. Snoring and hypothyroidism. Hypothyroidism is a disorder associated with reduced production of the thyroid hormones, resulting in symptoms such as weight gain, fatigue, depression, and slow heart rate. Another important characteristic of hypothyroidism is the enlargement of the thyroid, known as goiter, neck looking enlarged, that can interfere with breathing by obstructing the upper airway, causing sleep apnea and snoring. How is snoring tested? Snoring is tested using the home sleep apnea test, which involves using portable devices that measure breathing and blood oxygen level while you sleep. Another test is the in-lab sleep study, which is performed in a sleep center where brain waves, breathing, eye movements, blood oxygen, heartbeats, and limb movements are measured. What are the best snoring solutions? Snoring can be reduced through lifestyle changes, treatment for allergies, surgery, continuous positive airway pressure, CPAP, and oral appliance therapy. 1. Lifestyle changes. Reducing or stopping alcohol consumption can significantly prevent sleep apnea and snoring. Sleeping on the lateral side can reduce snoring. In addition to other benefits for health, quitting smoking can also gradually prevent or reduce snoring. Finally, losing weight through a healthy diet and exercise and avoiding tranquilizers and sleeping pills can also reduce snoring. 2. Allergies treatment. Allergies can cause chronic nasal congestion, and therefore, medications that reduce allergies can prevent snoring. 3. Surgery. To restore a normal breathing pattern during the night, surgery is performed on the nose or the back of the throat. 4. Continuous positive airway pressure, CPAP. This is performed using a device that gently blows room temperature air through a mask or mouthpiece to the back of the throat to prevent breathing pauses. 5. Oral appliance therapy. This therapy involves the use of a removable oral device and is recommended for individuals who cannot tolerate CPAP and whose OSA is moderate or mild. In conclusion, snoring increases with age and can be due to lifestyle, which can be reversed by making changes in sleep position, avoiding alcohol and smoking, and having a healthy diet. However, it can become serious and lead to chronic diseases such as cardiovascular diseases and type 2 diabetes if untreated. If you enjoyed the video, please like, subscribe, and share for more videos like this.